Good afternoon. Thanks for coming to this presentation, and thank you for the invitation to this conference. It's a pleasure and so far an amazing experience. So what I'm going to be presenting this afternoon is a case study of an integration case in my clinical practice. There's a lot of talk about integration nowadays in the psychedelic community. We talk a lot about the importance of integration, how important it is to provide integration settings. But I think that it's not completely clear what we mean by integration. There's different people doing different kinds of integration. So what I'm going to be presenting is a case that we did, joined with Imperial College, with Rosalind Watts was the co-therapist of this case as well. So I'm going to be presenting a case that we did. It's not the way that it's supposed to be. It's not the best way. It's not the only way to do that. It's just the way that we did that. The intention is that we get a little bit of an understanding of how can be the development of a practice, a clinical practice, a psychotherapy practice around psychedelic experiences. This is the first time that I present this case, so I don't have the timings of the whole explanation really well planned, so I hope that I will have time for everything, but I apologize if I have to run in the end. So I want to give some general thoughts on integration psychotherapy, and then I'm going to present the case. I'm going to go through the sessions and see what happened in that case and what things can be interesting to see from the case that we did, and then some conclusions. And I would like to have some time also for questions and answers, or to debate, or to give time to provide some feedback. So when we talk about integration, I think that to be really brief, there's like two main situations in integration. There's like two big categories or two big kind of boxes in which integration can fit in. One would be to maximize the benefits of a session. If we use psychedelics with therapeutic purposes, is that we understand that there can be some benefits from the session. So then one of the aims of integration should be to maximize those benefits. We've seen in some previous talks how after, for example, the clinical studies with depression, which is going to be the case that we're going to be presenting, people feel relief for the depression for 2-3 months before the depression starts to kind of come back again. So the integration in that case would be, all right, how do we anchor, how do we fix, how do we make those changes, those improvements to last longer? Okay, is there something that we can do, or maybe not? So this is one scenario in integration. And the other scenario is, what do we do in situations in which things have not gone as expected? And there's an increase on the symptomatology of people. People, for example, feel more depressed or more anxious, or they've been through an experience that they feel that has been traumatic, and that, in a way, makes things a little bit more complicated. So it's not that we're trying to get some benefits from that, it's that on a first approach, we're trying to get rid of something that was not there before, okay? We will see that we can work on these two things at the same time, or we can have like a general perspective of these two things when doing a psychotherapeutic process. But they are different kinds of practice. They are different objectives that we have when working integration, or at least this is how I understand that. In my clinical practice, I work at the ICERS Foundation, and most of the requests that I receive for integration is people that have had challenging experiences. So they come to a therapy service not because they want to maximize the benefits, but because they perceive that there's some harm that they are going through, and they want to get rid of something. So my bias is towards seeing the challenging experiences. That's the kind of people that ask my support. So this is my field of work, okay? But we will see in this case how we're going to start dealing with the adverse effects, but we are always going to keep in mind that what we want is to get some more well-being for the person. We want to see if there's something good that we can take from the experience, okay? Okay, so let's go for this case. I'm going to introduce you the case, and you will see that this is a little bit of an uncommon situation. When we think about integration, maybe we don't think of this kind of situations. So who was the person that came to receive integration therapy, and how did he come to our service? He was a person that had participated in a Psilocybin study. So he had gone through the whole screening protocol. He was taking good care during the session. He received what he needed to receive. So all the conditions were good, okay? He received 2 doses, a medium dose and a high dose. And although the first one was somehow challenging, the medium dose, the high dose, he describes that as being really, really challenging. And the interesting thing is that I am contacted 18 months after the experience, so this is a really long time after the original experience. This is a little bit of a not so common situation, because most of the times people contact us right away. It's like, I had an ayahuasca session last week and now I'm feeling anxious. But it is something that has been going on for 18 months already. So this is going to be something that we take into consideration when we start doing this therapy. So another thing that we need to consider also is that the patient was not paying for this therapy. This is a service that we offer at ICIR, so we offered our institution to cover this therapy. And that's also from a therapist point of view. When someone is not paying for the therapy, sometimes you wonder if there's a lot of commitment or not, but in this case we will see that he was very, very committed. So who was he? Male, 64 years old. He was married, 2 sons, and retired. Yeah. He was living in England in a quite isolated area, so he didn't have a lot of social connections. And again, very interesting, he had depression for a very long time, more than 20 years of depression. He had gone through different kinds of therapy, long psychoanalysis, he had taken different kinds of medication, and at the moment that he comes to this therapy, he is on trazodone, on 250 milligrams a day, and then he can use diazepam and naproxen if he needs that. He has also some physical pains, and he has some anxiety, and he can use diazepam if he wants to. He doesn't want to use it very often because he feels that that is addictive, so he's trying to deal with the depression and the anxiety on his own with this medication. Okay, so we go for session 1. Okay, that's the first time that I meet this person. And this therapy is done over Skype. The guy's in England, I'm in Barcelona. So it's we are 3 people in this therapy session. It's myself, Rosalind Watts, and the patient. Okay, so it's 3 of us doing this therapy. What do I want to do in my method of working? What do I want to do in the first session? I want to get a good relationship with the person, so see if we can trust each other, if this can work. Also, I want to have a little bit more of information of who am I dealing with, because all I know is that this person has had depression for a really long time, and now he's saying that he's experiencing some more adverse effects that were not there before the psilocybin session. So I want to get a feel of what is going on, and at the same time, it's going to be interesting in this situation to know how long has passed since the experience, and he's still having some challenges. So maybe we need to see what has happened throughout these 18 months, okay? Some important things to consider, as I was saying, these 18 months that have passed. The depression has been a resistant depression, so we're doing therapy, but we maybe don't have to expect very optimistic results. We're dealing with a difficult case. He's on many therapies, he's on psilocybin, so okay, let's be kind of pessimistic in a way. Okay, let's see if we can do something. And yeah, the therapy is going to be through Skype, which sometimes that's a little bit more challenge for therapists because you only see the face, and it's more difficult to have a general sensation of what is going on in the therapy. So what happens during this session? For me, it's always very important in all kinds of therapy, but especially in integration, to see why the person feels that he or she needs integration. It's like, what does the person want to achieve by this integration process? And it's important to see what is the person complaining about. So what the person complains in the first moment is actually about things that happen in his present. So he cries a lot, he's very angry, he feels depressed, he has this rumination about things, about not being better, and he's sleeping really, really poorly. And he says a very interesting thing that it's like, I have to sell my house, I have to get my house ready to be sold, and I am unable to do any of the tasks. And every time that I see it, I'm not able to do that, I get angry, I get depressed, and that's a confirmation of my problem. It's interesting that in the first session, it takes a really long time before he starts talking about the psychedelic experience. So one thing that we're going to be doing in this therapy is keep like 2 layers of therapy. On the one hand, we're going to work on a more, we could say like superficial level, what is happening today, how come that you feel depressed, this crying, this anger, this not being able to perform the tasks, and then another level, what happened in the psychedelic experience that you are connecting with these challenging symptoms that you experience in the present, okay? The good news is that the guy is very easy to work with. He's very cooperative. He explains things very well. He gives a lot of details, so I don't really have to ask a lot of questions to get the information that we need. He's a really, really collaborative person. So at some point we get to, okay, what happened in the psilocybin experience? How come that you say that you have an integration problem with experience? So what he points basically is that in the high-dose session, he had what he calls a revelation or a revealed memory, in which he saw something that was very, very disturbing, and that, on his own language, added a layer to his depression. That memory, that revealed memory, that revelation, added a layer to the depression. So the memory is that he saw his father trying to smother him with a pillow, and then he doesn't know if that is real or that is not. So the main demand for integration here is something that's actually quite common in this kind of cases in integration, is this issue of revealed memories, of recollection of biographical events that the person was not aware before, and people wonder, is that true, is not true? So that creates a lot of anxiety because the person cannot really decide if that thing that has seen is true or that thing that has seen is a symbolic thing. So when I ask to him, okay, what would you expect from this therapy? What do you want us to help you with? He gives these three objectives, really, really clear. Is this memory, is this revealed memory real or symbolical? Okay, he wants some help with that. He wants to improve his sleep and improve the depression and some guidance for next steps of treatment. At this point, the patient is considering to start taking lithium and to do ECT, electroconvulsive therapy. So he's quite desperate at this moment. He's planning, has a suicidal thought, and he's like, he uses a lot a language of if someone could rip me that sensation away from me, or if I could smash my head and not wake up anymore. It's like he feels like really, really tense and angry inside, and it's like something could explode and take that sensation away from me, okay? So again, this is a serious therapy, because if this doesn't work and the patient goes to ECT or lithium, that's a whole different course of treatment. We don't know how things can go, but lithium, it's something that it has to be taken seriously. Like you have to up the dose. You cannot. You have to do checkings of your system and your liver and everything, your kidneys every now and then. So it's something that it's not that easy. It's not a final solution to depression. Okay, so this is what we do in first session. In second session, what we're going to focus is on the content of the experience. Since he says that that was the revealed memory, let's explore what happened in that session. So since there were two sessions, we start with the low dose, and then we go to the high dose, which there's much more content in the high dose session. And some of the things that appear here when I start asking details about what happened here and then what, so I try to get as much detail as possible, because so far I only know about the revealed memory. But surprisingly, there's a lot of symbolical and phenomenological things happening in the experience. He talks about an upside-down temple. He talks about the sensation of having a probe into his mouth. He talks about the sensation of being breastfed or being inside of a chrysalis and trying to get out of the chrysalis. He also talks about a big insect in top of him trying to kind of choke him, and then the revelation of this revealed memory. Yeah. And when we talk about this, he gets really, really emotional. You can see that this is something that had a huge impact on him. And why was that so impactful for him? Because he says that it was more real than reality itself. It's like that experience was more real than us talking now. So the level of reality of that experience was totally, totally real for him. When we talk more about the session, he makes really fast and good connections with childhood memories, with psychodynamic and family issues that were happening in his life when he was a kid. And you can see from this graph model, this graph metaphor of experience, that there's different layers of the experience. There's experiences that go into the biographical domain. There's experiences that he talks about being reborn or going through the birth canal, or more transpersonal experiences of death and rebirth or transformation, like this chrysalis. And there will be more to come, you know. But then something becomes quite clear, that there's a lot of issues regarding choking. So there's this probe going inside the mouth. He talks about some eagles fighting that represent the family, and the eagles also choking him, then this insect on top of him. So the theme of choking is very, very present. But the person, the patient takes the revelation as a real memory, and the other aspects are symbolical. So there is something that he's not so convinced of what is the meaning of that. So he wants to know, is this real or not? Okay. One of the things that we do in this therapy is, since his father is dead and his mother is dead, we cannot have like objective confirmation if that happened or not. So there's a degree of certainty, and it's needed in the therapy to bring this degree of uncertainty. Maybe we will not find the final answer to your question, but there will be a way in which you can be comfortable with somewhere in between. And he says, yeah, I would need certainty to a percentage. Okay, so he's willing to have this percentage, and later in therapy, he comes to a percentage that for him is okay. So, and this is also important to consider. In the third session, we get into the conflict of this objective reality versus fantasy. Okay, and one thing that I will do during this session is not take part for any of the possibilities. I will not say that yes, this is a real memory, or no, this is not, or this is clearly symbolical, because it is not my role to decide. It doesn't really matter if I think that it's a memory or that it's a real revelation. So what we're going to do is to explore these two options. It's like, okay, let's assume for a moment that yes, it is real, and let's explore that. And then, okay, let's explore for a moment that it is not real, and see what are the consequences of that. And we devote a whole session for that. And he, as I was telling you, he explains things very, very well. He goes into a lot of detail, and then he goes back to childhood and brings things to the present. So the therapy is not like a fast therapy. He talks slowly, he talks a lot. So it's like a slow thing. It's like almost having a living room kind of conversation. Okay, we go slowly, we go step by step. So if the memory was real, if that recollection, that memory actually happened, then what are the implications? On a way, he says, it's a relief because that would justify my depression. If my father tried to kill me when I was a kid, that would justify that I've always had a degree of depression. It's like an eureka moment, he says. That would be a clear insight, like I discovered the core issue of my whole depression, okay? But at the same time, then would be conflicting with his memories from childhood, because his father was always a loving father. He always treated him very well. So he has no memories of the father being aggressive or being doing anything bad to him. So he has really, really good memories about his father. So then he would have to reconcile this idea of, was my father a loving father or was a bad father? So then the conflict goes somewhere else. And he says, but even if that would be true and that is a source of relief, he says that would be a masochistic relief. It's like I get relief because I know that my father tried to kill me. What kind of relief is that? So it's not so satisfying for him. Yeah. And then on the other hand, if it was a fantasy, if it's not a real thing that happened, then he says, I don't have relief because I cannot explain what my depression comes from. For him, it's worse than if it's real, because then I've been considering this for 18 months already, and if all of a sudden it is symbolical, it's like I've been worrying for something that I didn't have to worry before, you know? And then it says, and then I still have to continue looking for how to cure my depression. I don't have a reason for my depression, so again, it's a not satisfying situation. But again, in this case, he can trust his memories from childhood. He can say, okay, the narrative that I have from my childhood, it can still be the same because my father was loving and my father would remain loving if this is just a revelation, like a fantasy, a symbolical revelation. And then that would mean that I don't have an additional trauma, which is quite important. It's like, okay, to know that your father has not tried to kill you, in itself that brings some relief. Okay, so during this session, I introduced the concept of COEX system, which is a system of condensed experience. That's Stanislav Grof terminology, which Stan Grof says that in psychedelic sessions, what we usually see is that when a theme develops, So a theme that has to do, for example, with sadness. We enter in touch with sadness, and then all the experiences in our biography that have to do with sadness become easily available. So it's not that you go chronologically through your memories. It's like the theme is sadness, and then you can see sadness when you were, I don't know, a 6-year-old, but sadness when you had the first romantic deception, the time that you lost your jobs, and all these events are available for you. But what Stan Grof says is that we do not only have biographical and real events, but we have the events and associated fantasies about that theme. So, for example, if we tap into these coex of sadness, one could have this kind of archetypal experience of, I don't know, this Pinocchio story in which you're looking for your mother desperately and you cannot find that. You know that it has not happened to you, but it's like an archetypal representation of the same sadness or abandonment topic. Okay, so I introduced this idea to bring some flexibility there. It's like there can be things that are real, there can be things that are symbolic. It's not black or white, okay? So after this, what is what we find in this session? That even if the revelation is true or if the revelation is symbolic, none of the situation solves the problem that the patient has. So we are back again to the beginning. We introduce also the term, or we work with this idea of psychic reality. So in therapy, it's not so important if that's objective reality or that is a fantasy, because that has happened in the psyche of the person. So it's a psychic reality. And this is something that Sigmund Freud discovered already after his initial works with what he called hysteria and recovering these traumatic memories. He started doubting about if the traumatic memories were true or not, and he introduced this idea of the psychic reality. Whatever that happened or not, it has happened in the psyche of the person. So we work with the reality of a psychic event. It has happened here inside, so it has happened, okay? And this is one thing that I like to introduce in this moment, and he says the same thing, like finding the cause of depression didn't get any results, didn't make the situation better, so I need to do something else, okay? And then in the fourth session, we have something that is not very common in integration therapy that proved to be very, very useful. Since this happened in a clinical study, the session is recorded. So the recording is available. And then what happened here is that Rosalind Watts, she took the video and selected the moments that were more intense and the moments in which things were happening, and you can see that on video. So in this session, we play the video, and during the whole hour, we watch the video together, and we go to specific moments, and then we comment those moments. And this is something that in the early days, if you look at what Stan Grof was saying, what to do in integration, said, look at the recording of the session. So it seems that it's a good idea to record the sessions, because if needed, that can bring extra information. So what we are doing throughout all these sessions so far is that we're trying to gather as many elements we can from the experience, so we can start creating a new narrative of what happened. The narrative that the patient has so far is very limited. I had a revelation in which my father was smothering me. Is it true or not? So that's the whole story. We want to make it a little bit more juicier. There's more things in this story. So let's see if we can get another narrative. What happens when we look at the video? So all of a sudden, what he's very surprised is that from the outside, the experience looks much less dramatic than he remembers. It's like, I remember this being like really, really crazy, and then I just see two guys talking here and discussing some things, some experiences that are happening here, and he says from the outside, it even looks peaceful. It looks like a peaceful experience. So he gets another perspective on what happened. Yeah. And when the part of the revelation comes, he sees himself and at that moment says, I had this revelation or this came, and I know or I can see that my mom is playing tricks on me. So at the very moment when that happened, he framed that in a way that was through her mom that he had this revelation. And he remembers that it's not that he saw that his father was smothering him, it's like, I heard my mother saying, look what your father is doing to you. So then it starts to be not so clear what happened there. It's like, was it a memory that I had? Was it something that my mother told me? And then you have all these really, really difficult dynamics in childhood. And the parents had a really, really difficult relationship, and they had a divorce, and they were fighting for custody. So there was this thing happening that mom and dad were trying to present a bad image of the other parent. So his mother especially would talk really badly about his father. Yeah. And then he comes with more details, and he sees that the chronological idea that he had about the development of the session is totally different, that the order was different, that there's an evolution on the session, so things start having a little bit more sense for him. Again, in this point, we don't take any side. It's like, okay, this is what is happening, we're gathering elements, we're not jumping into conclusions. In session 5, we ask, okay, now that we've talked about the session, now that we've looked the session on video, how do you feel about everything that happened? And this is a very, very interesting session because on the one hand, he has gone to the psychiatrist and he was complaining about the symptoms, so the psychiatrist changes the medication and adds levopromazine, which is a medication that he had had problems with before. So he's kind of not so happy at this point, but we start talking about the session, and all of a sudden, for 40 minutes, there's a totally different narrative of what happened during that session. He talks about this rebirth kind of process. He talks about northern lights. He talks about love, bliss, feeling free, breaking free from a prison, being in a heavenly state, being part of the universe, being self-aware, being a speck in a huge consciousness, having an expanded consciousness. Like a totally different story. We didn't have anything of that before. So what we do in this session is to really spend time talking about that and bringing that to the surface and giving a lot of time and a lot of emphasis on this other side of the story. Yeah, he remembers very clearly the moment in which he took the rose, look at the rose, and how there was almost this mystical fusion with the rose. It was like he was seeing this heavenly state, this bliss, this peaceful state when in contact with the rose. So we devote a lot of time there, and then at some point of the session, we ask, okay, what about this revelation? What about this thing? How do you feel about that? And he says, well, now I think that on a 70%, it was a symbolical aspect. And he doesn't fully have a totally coherent narrative of why the revelation presented that way. He has some intuitions. Well, my mother was presenting a bad image from my father. So then he reframes the situation. Instead of my father smothering me, my mom was suffocating me when I was a child with everything that she was doing. So, yeah, with everything that she was doing. And at this point, what we do is we offer a different narrative. We say, okay, what was happening in your childhood, and we use his very words. He was using suffocating, choking. So we use this kind of words. Like, I can understand how in your childhood you could feel really oppressed, really suffocated by two fighting fathers that would take you to their battlefield. The mother would even, so the father had a mistress, and the mother would take the sons to the mistress' house to find the father coming out of the house and say, look what your father is doing. He's having an affair with another woman. So the kids were exposed to all these kind of family dynamics. So and then I offer this other version, like could be like that situation felt that for you it was very suffocating, and that your mother was trying to present your father as the responsible for that. I can see your suffering mother because your father has an affair, and trying to say, look what is happening because of your father. And that goes in very well to him. He gets that, and he reframes the whole experience. And at the end of the session, he says this: I believe the memory is 70% not true. My mother would have told me. It's like when his mother died, she left a letter with everything bad that his father had done. It's like, blah, blah, blah. But there was no mention to this event. Okay, so then it's like, if that would have happened, she would have told me. Okay, so then he gathers evidence and says, I'm getting some evidence, and I'm 70% sure that this was not true. Okay. What we ask at the end of the session, we suggest a task, and we say, go buy another rose. Because he's, so we're working on a psychodynamic level here, but there were other elements. We try to emphasize also this spiritual connection that he had with the rose, this bliss, and he asks for, how could I keep that connection? How could I maintain this sensation of being in touch with this blissful state, with this heavenly state? And since it worked through the rose, what we suggest is go buy a rose similar to that one and take care of it during this week and let us know how it goes as a symbolical or metaphorical or ritualistic way to have a physical connection with what we've just been talking about, okay? And then this session 6 happens 3 weeks later because there's Christmas in between, everyone is very busy, so we want to check how things are going. Basically, at this point of the treatment, I don't really know what we're going to do next. Okay, it's like we want to check what we've done so far. For me, it's a session of checking if things have been working so far. 6 sessions is a good amount of therapy, so we should see some changes. And yeah, so we talk about this revelation, how he's doing, and what is interesting is that he doesn't talk that much about the psychedelic experience. He's focused on the repairs on the house, he's focused on the relationship with his wife, he's focused on many other things, the anger that he feels on the morning. So what we see is not that he's talking very happily about the session, that he's focused on something else. It's like he's bringing the attention to the present problems. And at some moment he says, I'm happy because 50% of the treatment is done. It's like, okay, that sounds good. What is the other 50%? Okay, what is left now? And then we have to remember the objectives that he said. He said, I want to work also on insomnia and these depressive symptoms that I have, and then talk about future steps of treatment. So we're going to address that, okay? And this session, because we want to really anchor this new narrative that he has about the psychedelic experience, what we ask to him is to do a mandala or to do another trip report of the experience, what he does, and that helps him to have the story, like the updated story of his psychedelic experience and the whole therapeutic process, okay? So in session 7, we are trying to define some new objectives and see what we do from here. Okay, where do we go? What has integration worked or not? And yeah, in session 7 we confirmed that he has not been ruminating about the psychedelic experience, that he feels that added layer of depression is not there anymore. So we might as well finish the intervention here. Integration could finish on this session or the session before. But since we have agreed on doing some more sessions, we have the opportunity, and there's some other objectives that he wants to work on, we're going to shift into those objectives, okay? So he comes and says, yeah, the revelation is a symbolical experience for sure. He has not been worrying about that much. And then we do, so now I shift tracks and I focus much more on solution-oriented therapies. Like, okay, how are you going to know that these sessions that we're doing now work, that they are good for something? I don't know if you know this technique that's called the miracle question by Steve DeShazer. And it's basically, if you didn't have any problem, how would your day look like? Okay, and he's really good at that. And he says, I would wake up, I wouldn't talk that much about my problems. I would get ready to do the repairs of the windows or the ceilings of the whatever. So he has a really clear behavioral manifestation of what for him is improvement. So we're going to work in this direction now. If he doesn't bring the attention to the psychedelic experience, we're going to focus to close this therapeutic process, okay? Session 8 was supposed to be the last session, but it was not the last session because so someone wanted to do a documentary of this case. They wanted to record the session. So we tried to do like a nice rounding of the session, but there was an artificial session, so I'm not going to comment a lot on that. So session 9, okay, we focused totally on the depression and the next steps of treatment. That's what he asked. And he says, yeah, there's some days in which I feel better, yeah? But it's unpredictable which days are better. And he says, like, for example, like yesterday I had one of the best days in 20 years. I was like, yeah, what happened? Well, I was doing this and that. I woke up, I started working on the house, I was talking with my wife in a nice way, I was not complaining. But then on the afternoon, I was feeling terrible again. And it was one of the worst days in 20 years, the same day, you know? So that is very interesting. That shows much more flexibility. One day can be really, really good and really, really bad, which usually is what life is like. You know, some days are good, some days are bad. But when we are depressed, it's really difficult to accept this variation. We focus mostly on the negative aspects of life, and we think that they should not be there. Okay, so there is more acceptance of these bad days. He continues bringing every now and then recollections of the psilocybin experience, like, and I remember this part of the experience, and that makes sense, and I feel almost like in that moment of the experience, that blissful sensation, or I feel like the first weeks after the treatment that I was feeling really, really well. So it's not that we forget totally about the psychedelic experience. What we're doing now is like try to bring the good things from the experience to the present moments, like make positive connections with the insight of this psilocybin experience. And then we do some reframing and psychological education of, okay, it's normal to feel sad, it's normal to feel happy, it's normal that there is a variation, fluctuation in emotional states. And we provide some metaphors of life as sailing. He liked to sail when he was younger. And for sailing, you need wind. And then we provided this metaphor that emotions are like the wind. If there's no emotions, from Latin movere, which means to go into motion, then we don't sail in life, we don't move. So, but then you know how wind is. Wind sometimes is very strong, wind sometimes is soft. And you have to sail with the wind that you have. So some days the wind brings you difficult emotions, some days the wind brings you better emotions. And it's like, yeah, that is like being alive. That sounds like being alive. So we go into that direction. Same thing as before, but we are starting to close the therapy. He comes more active to session 10. Basically, he is okay. He's doing okay. He has some good days. He has some bad days. Mostly like we all do. He's kind of stressed with the home repairs. So we validate, we say, yeah, you're doing a great job, you're sailing through these difficult days, you're also sailing through the good days. He's socializing more with some friends. But there's one thing that has him very, very stressed. It's like, I have huge things to do. I have to finish the house because I have to sell it in 1 month, and I'm not able to gather the energy to do everything that I have to do. So then what we propose here is, and he says, I have this huge list. I write the list of everything that I have to do, and then I see that I'm not able to do that. So we propose this paradoxical task in which, okay, you're going to do 2 lists now. You have to write everything that you have to do during the week, and then you're going to choose 3 of them, which you leave. You're not going to do that. So it's like, no, but I need to do everything. No. You're not able to do everything. So you do 10, you write 10, but you cross 3 of them. So we're kind of frustrating his willingness to do everything and normalizing the fact that maybe you plan more than what you can do. And then you're going to do another list of the things that you're actually accomplished. We do that, and then in a month's time, which is going to be the last session for follow-up, so this really is an amazing session. We've not talked for a month or 5 weeks. And he says, I've been doing okay. Some good days, some bad days. I've been changing my diet. I'm more into paleo diet now. The things with my wife are okay. The house is almost finished. This thing of the list really worked, you know, because then all of a sudden I had less pressure of accomplishing everything. So when he doesn't try so hard to be well, to perform well, to get to this high achievement state, then he feels more relaxed, and he can maybe one day, today I feel sad, I don't feel able to do things, so today I don't do things, okay, and tomorrow I do. So he normalizes much more these fluctuations in affection. And he also says sleep is better, is not great, but it's better. Again, we have this flexibility developing here. It's not that things need to be perfect all the time, it's that things change. Sometimes they are better, sometimes they are worse. And this is the reality of most things in our life. And since it's the last session, I want to take again the thread of the psychedelic experience, because that was the reason because we started all this therapy. So this is actually what he reports. He is much more aware of the positive aspects of the experience. He can recall these feelings of oneness. He's not spending time in ruminating about this revelation anymore. And he says, I am a more spiritual person. And he says, the information is there and it's still dripping into my consciousness. The insights are still coming. So it's not that we finished with that. That is still a source of inspiration. That is still a source of more information. And he says, the whole experience changed me. I wish I had done it earlier. That's a completely different story than he was doing before. Like this added a different layer another layer of depression. And he says this very interesting thing. The revealed memory was real in 2016, but not in my past. It's like that happened in my psilocybin experience. That was real, but not in my past. Okay, so that is his conclusion. And to give you an overview of the whole process, we could say that the first 5 sessions, you have the dates here of the sessions. The first 5 sessions were totally dedicated to explore the psychedelic experience and to work in the integration framework. And the next 5 sessions were like a bridge between the psychedelic session, but bridging to the present problems and try to orient the therapy towards the future. If that was strictly an integration therapy, as I was saying before, we could have finished the therapy in session 6 or around that. And then last session was follow-up and closure. So some conclusions, we could take others, but yeah, we work both to reduce the adverse effects, to remove that layer, but also to bring the positive aspects of the experience to maximize the benefits. The integration process can be brief. We did 11 sessions in 19 weeks, which is not a lot of sessions. It's a good amount of therapy, but it's limited in time, which I think it's interesting in terms of cost effectiveness. And then how important is to individualize the process of integration. Each person is different, each need for integration is different, so it's important to work on a very individual level. And I think that for therapists working in this field, it's really important to have this concept of the objective reality versus the psychic reality. There's a lot of literature about false memories. There's tons of books. And I think that it is something that we are going to find in our practice, because psychedelic experiences can look very, very real, and this can be a source of anxiety. Is this a real fact, or this is my imagination, and the implications of each? Right now in my practice, I'm working with 3 people in similar situations. So people that have a revealed memory, and they are struggling because of that. So I think that it's a common thing that can start appearing more and more when these kind of therapies are offered to a wider public. And again, I think that the main idea of integration is to do as much as possible this bridging of different levels, from the transpersonal to the biographical, the perinatal, on the cognitive domain, the emotional, the body sensations, the social dimension. So to find relationships, I think that is where the integration is from. Not to focus only on spiritual domain or behavioral domain, but to set bridges across these levels. So that's it. Thank you very much.
Thank you so much, Marc. And we have time for at least one question.
Sorry, thank you. Just in the end, was he better than when he was before he had the psilocybin experience in terms of his symptoms? By the very end, when you finished the sessions with him, had he improved than before the session?
Yeah, absolutely. Actually, the level of improvement after session 5, he considered himself to be at least at the same point that he was before the psilocybin session. Okay, so in the first 5 sessions, we are oriented to get that extra layer, and the next sessions are to improve, to see if we can do something to improve the depression symptoms. So, but yeah, he considered to be much better than before.
Do you think that the medication that was introduced in the middle might have had any kind of effect?
I forgot to say that, but he left the medication 1 week after that because he was getting rushes, skin rushes. So he stopped all medication. So when we finished the process, he wasn't taking any medication at all. Thank you for reminding me. Yeah.
Okay, thank you so much, Marc. Another applause for Marc.
Thank you.
Yeah, thank you.